Hello and welcome. Today, we're going to take a calm and relaxing journey into the world of medical ultrasound. If you or a loved one have an ultrasound scan coming up, it's completely normal to have questions or feel a little anxious. My goal today is to walk you through everything, step by step, so you can feel informed, comfortable, and confident about your upcoming appointment. Let's demystify the process together. So what exactly is an ultrasound? You might hear it called sonography. At its core, it is a remarkable imaging technique that uses sound waves to create live pictures of the inside of your body. Think of it like a sonar system, similar to what bats or dolphins use to navigate. A small, handheld device called a transducer sends out high-frequency sound waves, far too high for the human ear to hear. These waves travel into your body and bounce off different tissues and organs. The transducer then picks up these returning echoes. A powerful computer instantly translates these echoes into the black, white, and gray images you see on the screen. The best part? It's all done without any radiation, making it an incredibly safe way to see what's happening inside you. The applications for ultrasound are vast and touch nearly every field of medicine. Let's talk about some of the most common types. For an abdominal ultrasound, your doctor might be looking at organs like the liver, gallbladder, spleen, pancreas, and kidneys. They can check for things like gallstones, cysts, or signs of inflammation. It's an essential tool for investigating abdominal pain or abnormal blood test results. Then there's the pelvic ultrasound. This scan focuses on the bladder, and for women, the uterus and ovaries. It's often used to investigate pelvic pain, check for fibroids or ovarian cysts, or monitor the early stages of pregnancy. For men, it can be used to examine the bladder and prostate gland. One of the most well-known uses is, of course, the obstetric ultrasound. This is the magical scan that gives expectant parents their first glimpse of their baby. Throughout pregnancy, these scans are vital for monitoring the baby's growth, checking their heartbeat and anatomy, determining their position, and assessing the health of the placenta and amniotic fluid. It's a beautiful and reassuring part of the pregnancy journey. But it doesn't stop there. A cardiac ultrasound, also called an echocardiogram, provides detailed, moving pictures of your heart. It allows cardiologists to see the heart chambers, watch the valves open and close, and measure how effectively the heart is pumping blood. It's crucial for diagnosing a wide range of heart conditions. Similarly, vascular ultrasounds, often using a technique called Doppler, can visualize blood flow through your arteries and veins. This helps detect blockages or clots, like deep vein thrombosis or DVT, and assesses the health of your blood vessels. Ultrasounds can also be used to look at the thyroid gland in the neck, the breasts, the testicles, and even the eyes and muscles. It's an incredibly versatile and powerful diagnostic tool. Now, let's discuss preparation, as it can vary quite a bit depending on the type of scan you're having. Proper preparation is key to getting the clearest possible images. For an abdominal ultrasound, especially one looking at your gallbladder or pancreas, you will likely be asked to fast. This means no eating or drinking for about 6 to 8 hours before your appointment. Why? Because food and gas in your stomach and intestines can create shadows and block the sound waves, making it difficult for the sonographer to see your organs clearly. You can usually still take your regular medications with a small sip of water, but always confirm this with your doctor's office. On the other hand, for a pelvic or early pregnancy ultrasound, you'll be asked to do the opposite. You'll need a full bladder. This usually means drinking about a liter of water or about 4 to 5 glasses an hour before your scan and not using the restroom. A full bladder acts as a sonic window. It pushes the intestines up and out of the way and provides a clear path for the sound waves to reach the pelvic organs like the uterus and ovaries, resulting in much better images. I know holding it can be uncomfortable, but it truly makes a huge difference. If it becomes too uncomfortable, please let the sonographer know. For other types of scans, the preparation might be different. For a cardiac or vascular scan, there are usually no specific eating or drinking restrictions, but you'll want to wear comfortable, loose-fitting clothing. You may be asked to change into a gown to allow easy access to your chest or limbs. For any scan, it is always a good idea to confirm the specific preparation instructions with the clinic when you book your appointment. Don't be afraid to call and ask questions. They are there to help. All right, let's walk through the day of your appointment. When you arrive at the clinic or hospital, you'll check in at the reception desk. Soon after, a sonographer, the highly trained healthcare professional who performs the ultrasound will call you in. They'll greet you, confirm your name and date of birth, and briefly explain the procedure you're having today. This is a great time to ask any last-minute questions. They will lead you to a dimly lit room. The lights are kept low to reduce glare on the monitor, helping the sonographer see the images on the screen with maximum clarity. They might ask you to change into a hospital gown, depending on the area being scanned. They will then help you get comfortable on the examination table. The sonographer will then apply a special gel to your skin over the area being examined. This gel might feel a little cool and wet at first, but it warms up quickly from your body heat. The gel is water-based and serves a very important purpose. It eliminates any air pockets between the transducer and your skin. Air is the enemy of ultrasound, as sound waves don't travel through it well. The gel ensures a solid connection, allowing the sound waves to pass directly into your body and back, which is essential for a clear picture. Next, the sonographer will place the transducer on the gel and begin gently moving it over your skin. You might feel some light pressure as they press down or angle the transducer to get different views. This is completely normal and necessary to get the best images of your organs from various angles. During the scan, the sonographer will be very focused on the screen. They are actively looking at the anatomy, taking measurements, and capturing still images and video clips of anything significant. They may ask you to do certain things, like hold your breath for a few seconds. This momentarily stops the movement of your diaphragm and helps to get a steady, clear picture of your abdominal organs. They might also ask you to roll onto your side, which can shift the position of your organs and provide a better view. As they work, you'll see black and white images moving on the screen. While the sonographer is an expert at interpreting these images, they are usually not permitted to discuss their findings with you directly. Their job is to perform the scan and gather all the necessary diagnostic information. A radiologist, who is a medical doctor specializing in interpreting medical images, will then review all the pictures and create a formal report. This separation of roles ensures a thorough and accurate diagnostic process. The sonographer needs to concentrate fully on obtaining the best images, and the radiologist provides the expert medical diagnosis. What you feel during the scan is usually just the cool gel and the light pressure of the transducer. Most ultrasounds are completely painless. If the scan is being done over an area that is already tender, you might feel some mild discomfort when pressure is applied. If you experience any significant pain, please let your sonographer know immediately. They can adjust their technique or pressure to make you more comfortable. The entire procedure can take anywhere from 20 to 60 minutes, depending on the complexity of the scan and what needs to be examined. Once the sonographer has captured all the necessary images, the scan is complete. They will give you a towel to wipe off the gel. The gel is easy to clean and won't stain your clothes. You can then get dressed, and you're typically free to leave right away. There are no side effects or recovery time needed after a standard ultrasound. You can eat, drink, and return to your normal daily activities immediately. If you had to fast, you'll probably be very ready for a meal. If you had to have a full bladder, you'll be relieved to finally use the restroom. So what happens next? What about your results? As we mentioned, the images and data collected by the sonographer are sent to a radiologist. The radiologist will carefully analyze the scan, comparing the findings with your medical history and the reason for the exam. They will then dictate or write a detailed report, which is sent to the doctor who originally ordered your ultrasound. This process usually takes a day or two, but the turnaround time can vary. Your doctor will then review the radiologist's report. It is your doctor who will share the results with you, explain what they mean in the context of your overall health, and discuss the next steps. This might be a follow-up appointment, a phone call, or a message through a patient portal. Be sure to schedule a follow-up with your doctor to go over the results. This is the most important final step in the process. To summarize, ultrasound is a safe, painless, and powerful tool that provides invaluable information to your healthcare team. From preparation to the procedure itself and understanding the results process, you are now equipped with the knowledge to navigate your appointment with ease. Remember, every member of your healthcare team, from the receptionist to the sonographer and the doctor, is there to support you. Don't hesitate to voice any concerns or ask any questions you may have. Your comfort and understanding are a top priority. Thank you so much for taking the time to learn about this process with me. I hope this has helped to ease any worries and has made you feel more prepared. If you found this video helpful, please give it a thumbs up and consider subscribing for more health and wellness content. Stay well and take care.